Mr. President, I come to the floor today to talk about the heroin and prescription drug epidemic that's gripping my state and our country. I come to talk about the 200,000 people in Ohio who are addicted. I come to talk about the police officers during Police Week who are doing their jobs to address this issue and why they need more help from us and how we should provide that to them. This is the sixth time I've come to the floor since the Senate passed back on March 10th legislation called the Comprehensive Addiction and Recovery Act. It was voted on by a 94-to-1 vote in this chamber, which is highly unusual. That never happens around here. And it happened because in every single state, people are seeing this addiction epidemic overdose issue. We need to address it. The House has been working on its own legislation. I've come here every single week that we've been in session since we passed our legislation to urge the House to act. I come this week to thank the House for acting, because on Friday last week, the House of Representatives passed by, again, a large bipartisan vote, legislation, 18 different bills that were combined into one bill to deal with this opioid epidemic. It's very similar in some respects to the legislation we passed in the Senate. In other respects, it has additional provisions I think are very helpful. In other respects, it doesn't pick up everything that's in the Senate legislation. Our focus here in the Senate was to have a comprehensive approach. And I believe that by including some of the Senate provisions in the House-passed version, we'll end up with a more comprehensive approach, and that's what's needed. In the Senate, we spent 3 months working with the House, in fact, on companion legislation. We had a number of conferences here in Washington, D.C., 5 different conferences on different issues to deal with this issue, and we came up with legislation that took best practices from around the country and included them in the legislation to deal with, again, a very real problem in our communities. It has to be comprehensive. Yesterday, I had the opportunity to speak with the Director of the Office of National Drug Control Policy, Michael Botticelli, as well as Dr. Kana Enomoto, who's the acting administrator of SAMHSA, the Substance Abuse and Mental Health Services Administration. It was a hearing of the Governmental Affairs Committee. We were talking about how to come up with the right response to this issue in so many different respects, and the bottom line is both of them strongly agreed. It has to be a comprehensive approach if we're really going to make a difference, if we're really going to begin to turn the tide and begin to save lives, get people back on track, and deal with this level of drug addiction and overdoses happening in our communities. We have to provide the resources, but we've also got to provide resources that are wisely spent. In other words, we have to be sure we're spending the money on things that are effective. I was grateful that both Director Botticelli and Dr. Enomoto said that they will work with us to try to get this conference between the House and the Senate done as quickly as possible. The House bill and the Senate bill coming together is really important so we can get this to the President, and more importantly, we can get it to communities to begin to help. They offered to continue to work with us going forward, and I appreciate that, and we'll need them. Everybody needs to pull together on this. It's been 67 days since the House and Senate, 67 days since the Senate acted. In those 67 days, if you assume that about 120 Americans are lost every day to drug overdoses, about 8,000 Americans have lost their lives to drug overdoses since the Senate passed its legislation on March 10th. Think about that. That's what I call an epidemic. Unfortunately, my state of Ohio has been particularly hard hit. The Center for Disease Control and Prevention says that in 2014, Ohio had the second most overdoses of any state in the union and the 5th highest overdose death rate. We're losing about 5 Ohioans every day on average to overdoses. We've lost 330 since the Senate passed the CARE legislation on March 10th. And since March 10th, unfortunately, the headlines have continued to show that families are being torn apart, communities devastated. These headlines make it clear this is not slowing down. I talked to some experts on this in Ohio last week, and I said, tell me, are things getting better? Are we beginning to change the attitudes, to turn the tide? And the answer was no. Actually, the hotline's lighting up more than ever. More people are coming for treatment. There's more crime than ever related to this. Sadly, I do not believe, you can say at least in my home state of Ohio, that we've begun to make the progress we have to make. And it's happening everywhere, in the suburbs, in the cities, in the rural areas. Addiction and its consequences are affecting everybody of every age, no matter where you're from, no matter what neighborhood you live in. It knows no zip code. Just in the time since I spoke on the floor just last week, in the past week in Ohio, here's some things that have happened. In Northeast Ohio, in a city, Lorain, police searched 3 different drug houses. This happened last Thursday. They arrested 7 people possessing more than 120 grams of heroin. In Southwest Ohio, in a rural area in Brown County, not in a city, in a rural area, a couple was arrested for possession of heroin. They have 4 children between the ages of 3 and 6. This all happened in the last week. In a suburb of Dayton, Ohio, this time not a city, not the rural area, but in the suburbs, Harrison Township, police say a man was driving under the influence of heroin, veered into the wrong lane, struck a vehicle head-on, killing an innocent woman and injuring her husband. More and more traffic accidents are being linked to addiction. In Central Ohio, the Columbus area, the city has now spent $144,000 last year alone on Narcan, which is this miracle drug to be able to deal with overdoses and save people's lives. Paramedics in Columbus spent 10% of their entire budget just on Narcan last year, reversing, by the way, over 100 overdoses. Paramedic Pete Bolin says that sometimes he takes up to 4 overdose calls every day. I've been to police fire stations around Ohio. In the firehouses, you know what they tell me? They say they're responding to more overdoses than they are fires. I think that's generally true in my state and maybe in yours. Dr. Eric Atkins of Ohio State's Wexner Medical Center says that their emergency room sees 2 to 4 overdose patients every day. Last year, this Wexner Center spent $1.2 million treating overdose patients. That's just one medical center in one city. In Chillicothe, Assistant Fire Chief Jeffrey Creed says that overdose calls are on pace to double this year as compared to last year. Again, he'll tell you more overdoses than fires. Rita Gunning of Grove City, Ohio, lost her daughter, Sarah, who was just 30 years old, to a heroin overdose. Last year, Sarah was trying to fight an opioid addiction and managed to stay clean for 50 days, but she relapsed. And 3 days later, she died of an overdose. Rita is now raising Sarah's 3 children and trying to increase the availability of naloxone around Ohio. She's on a mission because she believes that this miracle drug, naloxone, could have saved her daughter. She says, and I quote, "Maybe if they had it that night, they could have saved Sarah's life." She shouldn't have to say that. Making it more available, by the way, is one thing the legislation does that we passed here in the Senate. We got to be sure that the House and the Senate legislation does that and also provides the training to go along with it. Our legislation also says that when you provide naloxone or Narcan, you provide not just training with it, but also information about where to get treatment. Because it's not enough just to apply Narcan. We need to get these people into treatment so we aren't applying Narcan again and again and again. Karen Young of Columbus lost her daughter Kayla when she was just 22. She had surgery when she was 20 years old, and she was prescribed pain pills, as many of us have after surgery. She became addicted to those pain pills. And like so many others, when the pills ran out, she switched to a less expensive and more accessible alternative, heroin. She went to rehab for about 7 weeks, but she relapsed, overdosed, and died. Just like that. In the span of 2 years, she developed an addiction because she went in for surgery, and she died from it. As Karen put it, and I quote, "Her dad will never get to walk down the aisle with Kayla." Unfortunately, that's true with so many thousands of people whose lives are cut short across Ohio and across the country. The stories are heart-wrenching. You hear about kids who go in to have their wisdom teeth pulled. They are given prescription pain pills. They get addicted to the pain pills. They then turn to heroin, or maybe not. Maybe they even die of an overdose from the pain pills themselves, which has happened. But this should not be happening. That overprescribing of pain medication is obviously one of the huge issues here. 4 out of 5 of the heroin addicts in Ohio started with prescription drugs. People need to know that. Our legislation would allow people to know that, by the way, through an awareness campaign about that very issue. Unfortunately, these overdoses are just the tip of the iceberg in the sense that in addition to the 8,000 we've lost since March 10th in this country, there are hundreds of thousands more who are among the wounded. What do I mean by that? They've lost their jobs. They've been driven to theft or fraud to pay for their habit. They've gone to jail. They have broken relationship with loved ones because of an addiction. I hear this time and time again from recovering addicts saying, when I had this addiction, the drug was everything. It was everything. And that's how my family broke up. That's how I lost my job. That's how I lost my self-respect. I've seen the consequences firsthand. On Monday, I visited a treatment center in Ohio for women only. It's an extraordinary place, the only place in my hometown of Cincinnati where women can come to get treatment with their kids, which has been very effective. I got the chance to meet with a number of women who are in recovery, Each had a heart-wrenching story to tell about how they got there. And each was absolutely committed to dealing with their addiction for their sakes, but also for their baby's sake, because these women were pregnant. There's been a 750% increase in Ohio in the last 12 years of babies born with addiction. This syndrome, babies born with addiction, requires babies to be taken through the same kind of rehab that adults are taken through, of course, at different levels of treatment. It's a very sad situation. Many doctors and nurses tell me, who are incredibly compassionate, they don't know what the long-term consequences are. At this treatment center in my hometown called First Step Home, they're doing impressive work. They're teaching women how to be better moms in addition to providing them the treatment that they need. They don't just get medication, they get a sense of home and security. Talking to these women, listening to their stories, inspires me to make the federal government a better partner with First Step, other nonprofits around the country, to ensure that we are indeed beginning to turn this tide. Today and tomorrow, the Addiction Policy Forum, which is a coalition of advocacy groups, is leading a CARA Family Day on Capitol Hill here in Washington, D.C. I'll be joining them in that effort. I thank them for calling attention to this pressing issue and for their strong support of the Comprehensive Addiction Recovery Act, CARA. With this being Police Week, Mr. President, I'd also like to thank our police officers who are on the front lines every single day confronting this epidemic. Police, other first responders, medical personnel confront this epidemic more than anyone else. I've been told by prosecutors back home that in some counties in Ohio, more than 80% of the crime is directly related to this issue of heroin and prescription drug addiction. In some areas, I'm told nearly all the thefts that are committed are done by those struggling with addiction to pay for their habit. The Fraternal Order of Police has been incredibly helpful to us in this legislation. They contributed valuable advice and feedback during the 3 years we were crafting CARA, and I'm grateful for their help and for their endorsement of CARA, which was very important to getting such a strong vote in the floor of the House and the Senate. Police officers across Ohio have told me about the extent of the epidemic. They've told me about the need for the federal government to take action that is comprehensive. Major Jay McDonald, who is the president of Ohio's Fraternal Order of Police, has told me that, quote, heroin mixed with fentanyl is the most deadly drug cocktail I've witnessed in my entire career, end quote. I visited a place called Jody's House with him. It's a residential house for women in recovery in Marion, Ohio. Major McDonald told me that our response should include enforcement, prevention, and treatment. In other words, it has to be comprehensive. He's absolutely right. Our police want CARA for a lot of reasons. For example, CARA would authorize a new law enforcement task forces around the country to investigate trafficking in heroin, fentanyl, methamphetamines, prescription drugs. Police know that these extra resources will help them to do their jobs. By the way, these task forces are not included in the House-passed legislation. We have to get that in conference to ensure that we are helping our police officers who are out there on the front lines. Another reason I think that the law enforcement community wants CARA passed is that they are using naloxone every day, and more. First responders used it 16,000 times in Ohio last year. 16,000 times. CARA would increase access to naloxone. It would improve the training so that they can be more effective in administering this miracle drug in time to save a life. It would also insist that, again, as it's being administered, the drug treatment programs in the community locally are made available, information available to people so that we aren't just seeing this revolving door. If we give our police the tools they need, they'll be able to save even more lives and get more people into treatment. Our police are also helping to take drugs off the streets. Since 2014, DEA agents in Ohio, working with local police departments, have seized more than 171 kilograms of heroin. Federal agents have arrested now more than 70 drug traffickers or drug dealers in Ohio last year alone. Sometimes the intervention of a police officer is exactly what it takes to get somebody into treatment. I have found that again and again. 2 weeks ago, there was a heartbreaking story of a woman in the Miami Valley area, Dayton area, named Sherry, said she was glad her son was in jail because, quote, I'd rather have him sitting behind bars in jail than have to carry him out in a body bag, end quote. 2 weeks ago in Wellington, Ohio, there was a town meeting held about the crisis. Nicole Walmsley told the story of how, after postpartum surgery at age 19, she was prescribed a prescription painkiller. She became addicted. She ended up being arrested 18 times and convicted of 2 felonies. I sold my morals, she said. I sold my soul. Drugs became everything. After an overdose in Youngstown, she begged her probation officer to send her to jail. That's how bad it was. That's how difficult it is sometimes to find treatment. She asked the police officer and the judge to send her to prison because that's the best way to get good treatment, to be convicted of a felony, she said. And even then, sometimes not the best treatment is available. That's the status quo today. Unless and until we get a more comprehensive bill to the president and signed into law, this continues. Too many are going without treatment. Too many are afraid to come forward. Too many are treating this not as a disease, which it is, which needs to be treated, but instead are concerned about the stigma. We need to get people to come forward and come into treatment. But thanks to help from police, in the case of Nicole I mentioned, she did get treatment. And for 3 years, she's now been living a clean and productive life and helping others do so too. Police across Ohio have been offering treatment to those struggling with addiction. I'm impressed with what's going on in Lucas County, Ohio, which is in the Toledo area. Sheriff Tharp has started a drug abuse response team which offers addiction counseling, free rides to treatment to those who need it, and follow-up visits to those who have overdosed. In talking to Sheriff Tharp and some of his deputies about this, they've made an incredible difference in people's lives. In Lodi, Ohio, anyone can simply turn themselves into the police and they'll get treatment with no questions asked. This is done entirely using private donations. This year, they've already placed 28 people in rehabilitation who had no insurance and no income. The police there report that since they started the program, overdoses and property crime have decreased considerably. In Wellington and in Auglaize County, police make the same offer. Turn yourself in and get treatment. We won't ask any questions. We'll get you the help you need. I'm told this is also the case in Creston, Ohio, and Newark, Ohio. So locally, police departments are taking this issue up, dealing with it effectively, and I salute them for that. I also salute them for putting their lives on the line every day for all of us, and for their compassionate care of those they run across who need this treatment. I know the statistics about drug abuse are heartbreaking, Mr. President, and they can certainly be discouraging, including the relapse rates. But thanks in part to our police officers, good treatment providers around the country, as I visited on Monday, there are a lot of stories of hope, too, that encourage and inspire us. Many of those who are struggling have inspirational stories, too. In Coleraine Township, near my hometown, police have started what's called the quick response of police, paramedics, and addiction counselors. When they arrest someone or save them from an overdose, they get them into treatment. Again, not just applying Narcan, but getting them into treatment. Last summer, they found Damon Carroll, who was just 22 years old, on his bedroom floor after an overdose. They got him counseling, treatment. Damon is now living a clean and productive life, working at a restaurant. And you know who stops by his house and stops by the restaurant and makes sure he's okay? The police officers who found him. Thanks to our police, he's beating this. There is hope. They saved a life, and they're helping this young man to live out his God-given potential. Mr. President, I hope we can send comprehensive legislation to the White House as soon as possible because it's needed, it's urgent, it's an emergency. We've lost nearly 8,000 Americans since the Senate passed this Comprehensive Addiction Recovery Act. That's the status quo today. And again, that doesn't begin to tell the story of those who did not die because of an overdose, but struggle with that addiction every day. And our police officers and those nonprofits I talked about, those treatment centers, those who are struggling with addiction, all of them deserve better. They deserve us to act. Again, we're not going to solve the problem here in Washington, D.C., but we can be better partners with state and local government, with these nonprofits, with these law enforcement officials around the country who are dealing with this issue every day. They deserve a better partner. Mr. President, thank you for the time. I yield back.